what we're seeing in parts of Europe and in America really reflects the situation from the first wave. When we talk about the second wave, it is what happens after countries are able to contain the current situation, which is what countries like China, Korea, and Singapore have done in the early parts of March. We managed to contain the situation, but because the world epicenters still remain, there will be risk of importations, which is what we're seeing in Singapore right now, which is similarly what we're seeing in China. They have very limited domestic cases, but a lot of their transmission now is coming from overseas. And this is really the fear for what will be seeding the second wave, that countries that are still suffering the brunt of the coronavirus infections will be exporting people with the virus, especially as people who are citizens of countries are returning back, like what we're seeing in Singapore.
What happens next if governments are, with concerted efforts, are able to contain the second wave? Will we see an end to this problem, or is the only solution in sight a vaccine, which is 18 months down the line? Will a second wave feed a third wave, and will this issue carry on to drag, the health situation across the world?
So this is really where the global coordination in terms of managing the pandemic becomes absolutely essential, because the epicenters will shift constantly. Right now, your report says that the epicenter is now in the United States. Equally, in a month's time, the epicenter will shift. Would it shift to South Asia? Would it shift to Africa or Latin America? We don't know at the moment, but there is that real risk that the epicenters will continue to shift, and it could possibly even shift back to East Asia. And that risk will always remain until we have a viable solution to tackle this. And a viable solution will be in the form of having achieved a level of herd immunity. And I use this phrase herd immunity very carefully, because people seem to think that herd immunity must necessarily mean having an entire population exposed, infected, and lots of deaths before we can achieve a stabilizing equilibrium. That is not necessarily true, because herd immunity can be achieved with the use of a vaccine, like what you have mentioned. So when we start to talk about having the world see a solution from a vaccine, that is actually a solution that is aligned to the concept of herd immunity. It is only how we achieve the herd immunity, whether we use a vaccine to do that, or it is through the natural immunity that we acquire as a result of being exposed. Now, if we do not have a viable vaccine in the short term, this is where we have to try our very best to stretch out as long as possible this epidemic spread, allowing health systems to have the time to recover. Over to you.
Sir.
Hi, I'm Emily Tan, and thanks for watching CNBC. You can check out more of our videos by clicking on the boxes on the screen, and don't forget to subscribe to the channel for more. Thanks for watching.